Good afternoon and welcome to the Return to Campus Town Hall sponsored by Penn State Today. Today, we'll be discussing how the return to campus is going to operate. The university has sent several messages communicating the plans to return, but we wanted to give you the opportunity to begin to ask questions. We've already received nearly 3,000 questions for our town hall, and we will do our best to respond to as many questions as we can today or after this session. To answer your question today, we have with us University President Dr. Eric Barron, whom you will notice is alone in our studio so that we can all be with you today without our masks on. Joining via Zoom will be Executive Vice President and Provost Nick Jones, Vice President for Student Affairs and Co-Chair of the Return to Campus and Community Task Force, Damon Sims, Vice President for Human Resources and Co-Chair of the Return to Work Task Force, Lorraine Goff, an Associate Professor of Biology and researcher with the Center for Infectious Disease Dynamics at Penn State, and the co-chair of the Public Health and Science Assessment Task Force, Matthew Ferrari. First, Dr. Barron, would you like to say a few words?
Thank you, Ben. Well, first I want to say thank you to everyone. The last few months have highlighted the strength of our Penn State community, and we recognize it hasn't been easy. Now, what keeps me up at night is weighing the stress and concerns that each of you bear in determining what's right for your personal health and well-being and what will set you up for a successful future. You all have accomplished a great deal, proving time and time again that Penn Staters are resourceful, nimble, and resilient, and you've earned the right to be here. You have a lot to look forward to here at Penn State, and we've had round-the-clock discussions to extensively plan for the fall semester and help address those concerns to meet individual students where they are. We have heard from thousands of students, faculty, staff, our community members, and our peer institutions, and have critically evaluated all the feedback. Our decisions were not taken lightly. We're doing everything we can to deliver a high-quality education within a difficult environment, and we are committed. I know I speak for the leadership at each of our campuses when I say we're looking forward to welcoming each of you back and meeting our new students for the first time when we return in August. As you know, Penn State officials have determined that the university can meet or exceed the Pennsylvania Department of Education's guidelines for universities, and we will resume on-campus learning on August 24th with all in-person classes converting to remote delivery after November 20th. Graduate students will return to campus in the fall in a manner consistent with that described in the announcement I shared with you last week. While the specific environments associated with graduate education vary with program, Penn State is committed to providing a robust and meaningful experience for all. More details will be forthcoming from both the graduate school and graduate programs associated with individual academic units. For international students, we're excited to welcome scholars from across the globe into our community, even if current circumstances prevent residential study. We understand that travel restrictions and delays in visa process may make it difficult for international students to arrive in the fall, but we are committed to working with our students to support their academic progress, including providing remote options with cohorts. It is important to stress that while we are all enthusiastic about our collective return to campus, how the pandemic continues to unfold across our Commonwealth depends on all of us. This continues to be a very serious matter, and ultimately, whether on-campus activities can continue as planned through the fall semester and beyond will be greatly impacted by the actions of each and every member of the community in observing public health guidelines, which include wearing face masks and adhering to social distancing practices. We are already seeing increases in cases in some communities across the country where people are lax about following reopening guidelines, and officials may need to reconsider plans. But let me be clear, students, employees, and visitors are required to wear face masks in classrooms, and we will hold individuals accountable. Our expectations, of course, are also that individuals will wear masks on campus and in the community, as well as follow other guidelines for distancing and hand washing, for example. If masks are not an option for some individuals, we're looking into alternatives. To aid in this effort, as previously announced, the university purchased 500,000 masks to be distributed across all campuses for people who need them. In addition, distance markers, directional arrows, signs, and other visual cues will be installed in high-traffic areas, classroom, common areas, and study spaces and other shared locations, which also will be reconfigured with social distancing principles in mind. We know there's a lot on your mind that we will talk about today, including what life will look like on campus, how will housing and dining be impacted, and flexibility in the delivery of curriculum, to name a few. Given Pennsylvania's county-by-county approach to managing the pandemic, the status of each Penn State campus may vary slightly, as we recognize there are differences in location, residential, and commuter, and you will hear from chancellors on specific plans. The health and well-being of Penn State community is the university's first priority as we look forward to welcoming the community back to our campuses.
Thank you, sir, for that. Damon Sims, I'd ask you to make some opening remarks as well. Damon Sims is our Vice President for Student Affairs. Thank you.
I'm sorry, Ben. Let me begin by reinforcing President Barron's thanks and congratulations. The last few months have been unprecedented in any of our lifetimes, but the strength and resilience of the Penn State community have never been more evident. We pride ourselves rightfully, I think, on the vitality of the Penn State community, on our ability to engage both common foes and common purposes as one university. In recent months, students, faculty, and staff alike, including incoming students and their families, have patiently and responsibly faced head-on the challenges in which we all share. It's been a remarkable achievement, really, as President Barron said, and the strength and the resilience that have led to it will continue to serve us well in the weeks and months to come. We really can't say this too often. How we behave and the choices each of us makes over the coming weeks and months will determine whether the virus can be kept sufficiently at bay. My hope is that all of us, students, faculty, and staff, do what we must, even if it is inconvenient or difficult. We simply have no other choice, and as Penn Staters, we should expect nothing less of ourselves. Let me highlight a few key points about concerns I've been expressed, that I've heard expressed repeatedly in social media and other forums since we announced our intention to return to in-person experiences this fall. First comes the physical and mental health and well-being of our university community. These are always priorities, as you've heard, but never more so than now. After all, at its core, this challenge we all face is a health issue. You should know that we are adding staff and otherwise resourcing and preparing our campus health services across the Commonwealth to accommodate the necessary testing and provide related needs to all students throughout the year. We are developing a robust system for contact tracing, which will include at least 30 contact tracers who will interview those who test positive, identify those with whom they've been in close contact, and ensure that they too are tested and quarantined. We will identify isolation space so that those who are infected will be able to remove themselves from interactions with others, and we'll see that those folks receive all the support that they require to make that experience successful. Second, we need to be nimble and flexible since the dynamics of the virus are hard to predict. Although we're preserving the existing academic calendar and schedule as completely as possible to avoid complicating the task of delivering the curriculum, we're also using multiple modalities to do so, including remote access, even to those classes that will be offered in person. This will allow access to the curriculum no matter where you are, including international students and others who may be unable to join us in person. And it should encourage those who are feeling under the weather on any given day to simply stay home to keep others safe and to continue their academic progress even as they do. Not surprisingly, on-campus housing has been a source of considerable interest, and there are a few aspects of our plans that you should know. For instance, no residence hall room may be occupied by more than 2 residents. And to the fullest extent possible, single rooms will be available to immunocompromised or at-risk students, as well as others who request them, although immunocompromised students will, of course, receive priority consideration. Residence hall facilities will be cleaned in a manner that's recommended by the CDC and other public health entities, and bathrooms will be cleaned twice daily. Mask requirements will be vigorously enforced in the residence halls, and our residence life staff will adjust their usual programming and interactions with students to honor physical distancing requirements. Seating will be substantially reduced in common areas to accommodate physical distancing, and all lounges in the residence halls will initially be closed, consistent with the governor's guidelines. Campus dining, both in the residence halls and elsewhere on campus, will be considerably altered, but the focus will remain on quality, convenience, and comfort, even as we do what we must to discourage the transmission of the virus. Alterations will include limited seating and other arrangements to encourage physical distancing. Mobile ordering and carry-out options will be significantly expanded to reduce wait times. And in the dining commons, self-serve options will be removed, consistent with public health recommendations. But you'll still have access to more food and more variety at more times of day than any human requires. Finally, I'd like to say a word about the student experience outside the classroom that is near and dear to my heart and has always been among the wonderful reasons that students choose Penn State. What we're inviting you to return to is not simply in-person classes, but also in-person experiences beyond the classroom that include recreational facilities and activities, involvement and leadership in student organizations, student centers and libraries, cultural and entertainment events, civic engagement, and community service. How we encourage all those critical aspects of the student experience may vary from campus to campus, and certainly will require substantial change from past practices. But we want you to know that we know how important all those things are to your experience. And I make it my personal commitment to you to do all I can to see that your lives beyond the classroom are meaningful, engaging, and safe. My son, Ethan, is an incoming freshman at University Park, and he'll have my hide if I don't make good on that promise. I look forward to your arrival later this summer at all our campuses, and I'm eager to join my colleagues in answering your questions today and in the weeks ahead.
Thank you, sir. It's nice to know you have someone keeping an eye on you as well. Thank you, Dr. Barron, as well. We'll begin our first question with you. What should students be doing to prepare for their return to campus?
Well, of course, keeping safe. And, so much of this is really a personal decision about how it is that we're going to function in this world. And so making sure you're safe before you come to this campus, the extent to which you can quarantine yourselves before coming, wearing a mask. It is remarkable, really, the amount of information that is out there that suggests social distancing and mask wearing is a protection against the spread of COVID. So really, this starts before you even come on campus, and it makes a tremendous amount of difference.
Thank you, sir. We'll stick with you. It was mentioned in the opening statements, but can you give us a little bit more detail on the flexible options for students who can't return or maybe don't feel safe, or as Damon said, even just that day, they're not feeling ill and they want to be safe and keep others safe as well?
Well, to say this in the most general way, the best descriptor is flexible and nimble. We have a long history from the World Campus in terms of online education. We have an active number, a very active and talented group of people that work on delivery of a curriculum. We transition to a remote education very, very quickly. We have many, many residential students who take classes online because it adds flexibility and it promotes lifelong learning. We're doing many, many things so that classes have a dual mechanism for delivery. So this just defines this sense of being flexible, being nimble, this commitment to meet you where you are. And we have this other concept at Penn State, which is one Penn State. And the key here is this commitment to deliver world-class education, top 1% in the world, to deliver that regardless of mechanism.
And I understand there's a start at home and continue at home program.
So there are quite a few programs, but that certainly is one option for an individual. Again, this is a matter of being flexible and nimble, meeting students where they are.
And I think it's great that, so many ways to do this that we're not going to delay their academic progress. Thank you, sir. Damon, if we can address a question to you, what options or accommodations are you offering high-risk or immunocompromised students, and who should the students contact to make those arrangements?
Oh, that's a very important question, of course, Ben, and we are concerned about the health and safety of all of our students, but in this context, particularly those who are at high risk or immunocompromised. First thing we say to those students is it's very important for them to discuss a plan for their return with a treating physician at home before they return to us. And then if they decide to return, they should establish care with a university health services provider or a local specialist who can direct and coordinate whatever care it is they need for their particular condition. This may be an obvious thing to say, but it's very important for them to arrange a flu vaccine. We anticipate the flu season and perhaps COVID-19 will come at the same time. And it's very important for students to do what they can to minimize the risk of flu by getting vaccinated. We're going to provide housing accommodations, as I mentioned, to students who seek singles. And I think these students probably will be among those who would seek those singles, and they will have preferential treatment in that process. And then, of course, all this stuff we're talking about regarding physical distancing, mask wearing, hand hygiene, it's extraordinarily important that all of us honor those expectations, but it's especially important for students who are at high risk. They should also, where possible, do all they can to avoid undue stress and get plenty of rest. It does us good, all of us, but particularly for those students.
Thank you. Nick Jones, we have a question for you, and we've had numerous graduate students write into us and ask how this is going to impact their area of study.
Thanks, Ben. As we know, the graduate experience is a special one and a unique one to research universities like Penn State. Many of the things you've heard President Barron and Vice President Sims discuss already, of course, apply in very general terms to graduate students. But in addition, there are things that are really unique to their programs and to their individual courses of study. And so this is top of mind for us as well. We're absolutely committed to ensuring that every graduate student has a robust and meaningful experience. There'll be more details coming from the graduate school to provide guidance for students, graduate students generally. But the important point of contact for all graduate students is, of course, their department and their thesis advisor. These are the most important resources, and all students should be reaching out to those individuals for specifics. I can say that for some of the things that are most important to our graduate students, for example, dissertation deadlines, the ability to defend a dissertation virtually, these are all things that are on the table for us for consideration. Flexibility is the order of the day, and we want to support our graduate students to be as successful as they can be.
Thank you. Matt Farrar, we have a question for you about epidemiological modeling and what's been done to look into how the return of thousands of students will affect any potential dispersal of COVID-19. More questions on, will the university be testing each student, and how could you contact trace students? A lot to unpack there.
Sure. So I'll check back in halfway through. First of all, thank you to whoever asked that question. Epidemiological modeling is what I do most of the time, and so you'll get extra credit in any of my classes. We've actually been using quite a bit of strategies to try and look forward to what might happen this fall and how we should prepare. So we've been using epidemiological models, projecting scenarios, projecting worst case scenarios to see how fast an epidemic might spread and what that might mean in terms of demand on our health system, on our campuses, as well as in the communities surrounding our various campuses. And we've been using those projections to help guide the way that we're allocating resources now, the way we're staffing contact tracers, the way that we're the amount of facility, the number of facilities that we're setting aside for isolation and quarantine. So very much we're using our scientific expertise that we have across this campus, drawing from faculty all across the Penn State system to help us project what might happen and use that to help guide our preparations so that we're doing so in the most informed and evidence-based way.
And how about the testing? How are we going to be testing students?
Yeah, so there's really three components to the broad testing strategy that we have planned. That's of course rapid and immediate testing of symptomatic students, so that we can identify those that are ill and get them into isolation, or in fact identify those that are not infected with this coronavirus and give them the confidence that they can return to study. Right. We also are then, if we identify someone who is infected with this coronavirus, we'll then do rapid contact tracing and test those contacts, again, trying to identify anyone that might be pre-symptomatic or asymptomatic, so we can rapidly isolate them and reduce the potential for transmission elsewhere in the community. And then the third component will be a program of systematic asymptomatic testing, which is going to allow us both to hopefully identify some cases that we might not otherwise get them into isolation, as well as to monitor the changing levels of prevalence of this infection on our campuses and allow us to detect changes or trends of increase or outbreaks. Right? Each of these are going to be differently emphasized at different points in the semester and at differently across our campuses, because the epidemiological situation will be consistently changing and will differ depending on the local and regional epidemiological context on each of our campuses.
Thank you. Damon, if I could ask you to expand on that, and what sort of support services are going to be available for students who find themselves in a situation? Damon, if I could ask you to unmute your microphone.
I keep trying, Ben. Sorry about that.
That's all right.
That's a very good question, because isolation is not going to be easy for students who are in it, of course. The first thing we're doing is to identify space that will be used for this purpose. So we'll have a place for students to go who must be isolated. University health services, or at University Park, or a campus nurse on a campus will provide each of these students with a care package. They'll get a mask, thermometer, tissues, hand sanitizer, wipes, instructions for isolation, clear instructions, and resources for additional support. Importantly, they're going to be contacted daily by the University Health Services to follow up on their condition. And then we recognize that other kinds of support will be critically important. So mental health support through counseling and psychological services, academic needs to make sure that they can continue to progress with their degree programs, communications with faculty that may be necessary that we could facilitate, assist with. And then, of course, addressing their basic needs, such as food, personal items, and laundry. We're going to accommodate all those needs. So this will not be easy for them, but we're going to make it as seamless as we possibly can and provide the support necessary for them to get through it successfully and continue to progress academically.
Thank you, sir. Dr. Barron, we have a question for you. And what is being done by our medical staff to prepare for this? And can local hospitals handle a large outbreak?
So, thank you for that question. Of course, you've already heard part of it, the key in terms of testing and tracing that is a key to understanding how something is evolving, and the focus on mask and social distancing and designing our spaces to help promote that, which act as preventative. In addition to that, there have been a number of changes within our University Health Services. We're in close partnership with the associated health providers around the university, and we have also created, as Damon Sims has said, the opportunities for isolation and for quarantine. So one thing that we announced today is that we have set aside a hotel, one of the university hotels. We have closed the hotel at University Park so that we can provide rooms with private bathrooms to enable students to continue to be successful, and at the same time make sure that they're quarantined if they've come in contact with individuals. You also heard that we were quite fortunate in having residence halls that were going to go offline for construction that quite some time ago we decided, because of COVID, that we would keep them online so that we can maximize the opportunity for someone who is compromised because of other issues to have single rooms. And first doing this for people with those conditions, but also as available for other individuals. So a huge portion of this is to make sure that we're not overwhelming the health systems if necessary. And so that is really our objective.
Thank you, sir. Damon, we have another question for you. And what are the plans for enforcing mask wearing?
Well, I hope that everyone knows how important mask wearing is. President Barron is emphasizing that clearly, but there have been messages throughout the world, really, about the importance of wearing masks. Despite our assumption that most people know this, we are launching a robust social marketing campaign before arrival and after that will emphasize the aspects of the public health expectations that are so critically important if we're going to succeed with this, including wearing masks. We will require everyone to wear masks in campus buildings and in classrooms. We'll certainly encourage them to be worn elsewhere. We've purchased an ample supply of masks, I think 500,000 masks, which we will distribute to students. But then there'll be very strict enforcement of this expectation in the classroom, where we can have the most control over this, probably working in partnership with our faculty and supporting their efforts to impose this restriction on our students. We're also counting heavily on peer influence. I've had lots of conversations with student leaders over the past few weeks. I think they're eager to partner with all of us to make sure that their peers do what they need to do to keep one another safe. And then finally, if all those means fail for whatever reason, we have a code of conduct with expectations about how students will behave. And we have a provision in the code of conduct that's stated failure to comply. And so if you fail to comply with this quite reasonable expectation in the context of a pandemic, you will be subject to a student disciplinary process with a variety of consequences that could flow from that. But we certainly hope that it doesn't come to that, and that everybody's in this together and will wear masks appropriately as they must.
Thank you. Lorraine, we have a question now for you. And how are the faculty and staff going to support students during their time on campus?
Thank you for the question. The support of students is always a top priority for all of us that work in higher education, faculty and staff, and that will continue. We have been remote now for the second part of the spring semester, and the university learned a great deal from that. And so what we learned will be part of what we can carry forward into the fall semester. Certainly we will be creative, potentially about access to support and services on campus, but we are prepared to manage that. We also know that we have some members of our community, faculty and staff, who are concerned about their own safety and their own health. And we have in place a process that we've created to allow for work adjustments for those individuals that may be immunocompromised or have members of their household who are in high-risk categories. That be managed at the campus and the college level to address those individual concerns about their own safety. We hope that having that in place will alleviate some of the personal concerns. We can continue to provide the support that we know our students need and expect from Penn State.
Thank you. Nick, we have a question for you now, and it's again regarding the graduate students, and some of them are raising concerns regarding safety in the classroom and perhaps what they can do if they're feeling pressure from their advisor to resume in-person activities and they don't feel they're ready.
Thanks, Ben. Important question. No member of our community should feel pressure under the current circumstances to be in an environment where he or she doesn't feel safe and secure. As you've been hearing from others on this town hall, we're doing a lot of things to ensure the safety, safe practices and safe environments. And of course, we would like to think that graduate students will benefit from all of those. In particular, in the laboratory environment or other more intimate environments that graduate students find themselves in, we would expect appropriate social distancing practices as well as all other safety precautions with PPE, so on and so forth, to be in place. If a graduate student feels that he or she is being pressured to be in an environment in which he or she is not comfortable, they should always feel empowered to go to their department head to express a concern. There's also the graduate student ombudsperson to whom they can reach out for advice and guidance. So we're doing a lot of things to make the environment for graduate students as safe and secure as it can possibly be. But we recognize that if a student has concerns, we have support mechanisms in place and people to whom they can go for assistance.
Thank you. Dr. Barron, we'll go to you next. What is Penn State doing for low-income families who've been severely hit because of this COVID-19 situation?
So there are a lot of efforts underway. So, first step is that we reduced for summer session tuition in order to reflect the fact that we believed it was quite possible that a number of our students were challenged by unforeseen financial circumstances associated with their families. We have asked once again for the Board of Trustees in a few weeks not to raise tuition for any of our student populations. We've also worked hard with many of the academic leaders of the university in providing funding for a student emergency fund, where we're focused on making sure that if there are unforeseen financial circumstances or challenges, that we can make sure that we're there to help. We have another program, Complete Penn State, for people that are close to the end of their degree to make sure that very different issues, including financial issues, do not stop them from getting to the finish line. And we are busily enhancing our ability to attract scholarship resources to assist students. So access and affordability is extremely important to the university and to you. And so we're working on this from multiple fronts.
Thank you. Provost Jones, we have a question for you regarding international students. And many of them have written to us and they're concerned, particularly as there continues to be flight restrictions into the United States.
Yes, and it's not just flight restrictions, Ben. We know that some of our students, particularly our new students, are struggling with inability to get their visas processed in time for the start of the fall semester. So we're very sensitive to these issues. These students chose Penn State for a reason, because they see us as a high-quality academic environment of which they would like to be a part. We, in turn, selected them for a reason, because we really want them to be part of that dynamic educational environment that we really cherish. We have some challenges with students who find themselves in this position, but our commitment to them has not changed one bit, and we hope that their commitment to have a Penn State educational experience won't change either. So we're doing a lot of things to ensure that those students stay connected, minimize the likelihood that there will be any impacts on their academic progress. Our faculty are working very hard through remote and online environments to ensure that students have access to the full programming that they would have otherwise had in person. And things continue to evolve very quickly. And I'm hoping that within the next few weeks, actually, we will be coming out with a fairly specific suite of options and alternatives for international students who find themselves in challenging environments that really provides a great deal of flexibility to keep them on track to making the academic progress they desire.
Thank you. Dr. Barron, we've had several questions regarding what future commencements are going to look like and how families can start to plan for these occurrences.
So we're working hard to assess conditions in order to decide how to move forward. We've actually been very systematic in looking first at spring commencement and second at summer commencement. We, of course, do not want to create a condition with thousands of individuals. In fact, that would go against the guidance from the governor, but we don't want to have that environment of thousands of individuals within enclosed spaces. So we have created what I think is a virtual commencement that is incredibly upbeat. Many people told me it really brought tears to their eyes and a joyful occasion, while at the same time committing ourselves to bringing people back on this campus when we are capable of doing it in person, because this is a moment to celebrate. It's a tremendous accomplishment, and we want to make sure students have that opportunity. Our virtual programs are designed to make sure that you have that credential. Your degree has been awarded through the authority of the Penn State Board of Trustees vested in me as your president. So we're going to make sure you have that degree, that it's been awarded, and we will also, regardless of what happens, make sure we have that time to celebrate your accomplishments.
Thank you. That's obviously of concern for graduating seniors who want to go out there and apply to a grad school or to get a job. Thank you. Matt, we have a question for you. What is the procedure if there are COVID cases reported on campus after students return?
Yeah, so there are a number of procedures that will be triggered if we do have cases on campus. So there's individual procedures, and then there's the broad set of reporting. Right. So first of all, every case that happens on campus has to be reported to the Department of Health. It's important for us that information be broadly disseminated so that everybody on each of our campuses and everybody in the surrounding communities understands what's happening on our communities. It's really we're really committed to transparency in this process, because it's important that everybody understand what's going on, what the risks we're all facing, and how to adjust and change their behaviors associated with that. Redoubling their efforts at distancing, mask wearing, et cetera, right? Hygiene, right? If we start to see an increase in cases, we need then everyone to come together and again redouble their efforts to to participate in the reduction of transmission and limiting the potential scope of an epidemic that might then have downstream consequences that would be upsetting for us all. So that's at the large scale, right? We also then have individual procedures that are triggered when an individual is identified as positive. First of all, we will then have a follow-up interview with that individual to identify close contacts. Right? We're asking that everybody pay attention, to identify who their contacts are, be forthcoming with that information, because it's important that we then track those individuals, contact them, and schedule them for subsequent testing so we can identify individuals that are likely to have been exposed and might possibly be in the pre-symptomatic or asymptomatic phase of this infection. And so we want to identify those individuals through testing and get them into isolation as rapidly and quickly so we can limit any potential onward spread. Right? So there's a number of these procedures, both that might happen at the individual and at the community level, and it's really incumbent upon every one of us to participate in that procedure and to be a part of that procedure so we can minimize the potential impact of any case that we have.
Thank you. Matt, we'll stick with you for just a moment longer. And if someone is exposed, how are they going to quarantine if they have a roommate, if they're living with someone else on campus?
Sure. So first of all, if you were exposed, then you should be identified through the contact tracing process. Or in fact, if you even find out that someone that you know was exposed and you weren't identified through the contact tracing process, we would ask you to call University Health Services or whatever the corresponding point of contact is at your campus, right? And identify yourself as having been in contact with someone that has tested positive, right? And then follow the procedures that are going to be that you'll be presented with, and you'll be given very specific instructions on what to do, how to schedule testing and follow up, and what the guidance should be from that point forward. Right? Our goal is to provide resources for each student, whether they've been infected or simply been exposed, so that they don't present a risk to other students, and provide opportunities then for solo accommodations with a solo bathroom, right? So that you will be removed from that setting and unlikely to present a risk to roommates or anyone else.
Thank you. Damon, I'm going to go back to you. You brought up mental health concerns earlier, and just what is the university doing to address those concerns? Many people are very worried right now.
Well, this is always a very important issue to us. We've given a lot of attention to student mental health at Penn State in the last few years, but I think these circumstances really give rise to additional concern about students' mental and emotional well-being. Fortunately, we have a wonderful service in place. We have some of the very best, most sophisticated mental health professionals in higher education who focus on student mental health, and they're really exceptional. They have, through this experience of the last few months, managed to stand up their services and programs in a teleservice kind of way, so we're fully equipped to deal with things in a remote environment, and I think that's a real benefit to everyone. The online services that we offer through counseling and psychological services are really quite remarkable, and I encourage students and incoming students to look at those just to acquaint themselves with what we have available that may be of use to them. And we're considering ways that we can further expand those offerings in this context. And given everything else that's going on in the world, I think it's increasingly important that we do so. And then finally, Matt's reference to quarantine and isolation. This is going to be a very important element for students who are quarantined or isolated, to make sure that they have the right support for their mental and emotional well-being. We're going to have case managers who reach out daily to those students to have conversations about their needs and situation. And then, as necessary, we'll provide additional assistance. So mental and emotional well-being of students in these contexts will be one of our foremost concerns, Ben.
Thank you. Dr. Barron, a question for you now. Will tuition, housing, and meal plan costs be prorated to reflect the shorter semester?
So in the spring, when we went remote, and therefore students were not using food services or housing, we provided a refund. And If these services are not utilized, we will continue in that mode. In contrast, we did not change tuition. We have a very dedicated faculty. The faculty that teach residentially teach remotely. We have the identical learning outcomes that are expected. We have an extraordinary set of resources, growing resources that are committed to teaching regardless of environment. And so we're going to deliver that same high-quality education, and we're going to make sure people get the credits, get to the finish line, and they have the outcomes that are necessary for them to be successful.
Thank you. Provost Jones, we have a question for you. Dr. Barron outlined that classes are going to be converting to remote delivery after the Thanksgiving break. So will there be alternative grading options in place again as there were last semester? And how will the final exams be carried out?
Back in the spring, students got a big surprise when they returned from spring break and realized that we had transitioned from mostly residential delivery of courses to remote. That was a big shock to everybody's system. There's the faculties, and we realized that was quite disruptive. So we introduced the alternative grading scheme to give students a little bit more flexibility. You may be aware we introduced the V and Z grades, which were effectively no fault grades that reflected the complexity of the semester and the suddenness with which this transition was imposed upon so many people. As we transition into the fall, we're well prepared, not only to make the transition because we've done it before. It is at the tail end of the semester. We expect our faculty and students will be preparing for this, so it will be considerably less disruptive. And so for that reason, we will stay with the traditional grading system for the fall semester. As far as examinations are concerned, we learned a lot in the spring about how in many classes where traditionally final examinations are given in a residence format could be shifted to be provided virtually. So we learned a lot of lessons, most of them good lessons, a few bad lessons, and we aim to put all of that learning into effect this fall so that the final examination period can be delivered very effectively to students who are not on campus.
Thank you. Damon, we have some more questions for you. And this was a question we received again at the end of last semester when there was that rapid change, but what happens to off-campus leases if we're potentially not allowed to go back?
Well, Ben, as you know, that's a very personal and individual issue for a student, and it may differ depending on the facts of the particular situation or even the contract terms involved in an individual's lease. Because it's a legal matter, or it can be a legal matter, I would encourage any of our students at any location to contact the Student Legal Services. Student Legal Services is located here at University Park, but in the last several months, we've expanded those services to benefit students at all locations. So they're available to consult about lease terms and what the options are that might be available to students. I do know that most landlords, at least in our experience, are willing to accept a replacement tenant. Admittedly, those are going to be pretty hard to find in these situations. But the one situation that may be important that we should mention is for international students. Those students who can't, for reasons beyond their control, return to us, but who may have leases someplace, that may put them in a category that's called frustration of purpose, where essentially the lease can't be carried out, the contract can't be honored. And so that again is an area where I think student legal services could be very helpful to students, but international students may find themselves in a somewhat different situation than domestic students would.
Thank you. Dr. Barron, we have a question, and we received it many times, particularly from freshmen who are concerned that as they start their academic career here at Penn State, all of their classes might be online. As you go into those freshman classes, many of those gen eds are larger. So what is the university doing about this, and when will students find out?
So thank you for that question. It is an important one, and it would go completely counter to what we're trying to do if a student came back residentially and all their classes were online. So we have considerable effort to make sure that doesn't happen. So not only do you have the opportunity to be on a campus and have a sense of that greater community, albeit with social distancing and other factors, that educational experience that we deliver has breadth. It would be completely counter to our objectives if that were to occur.
And when might incoming students find out about what their schedule will look like, especially when regarding remote and online delivery?
So if we're looking at specific dates, I probably should turn the microphone over to our provost. But I do know our teams are working hard at this, working with our advisor corps, and people will begin to see announcements of how it is that they will get to proceed.
Provost Jones, without holding you to a specific date, in general terms, when can people expect to find out?
I would think, Ben, probably mid to late July, but certainly in plenty of time for students to make appropriate plans relative to returning to campuses.
Thank you. Damon, we've got another question for you. And many students are wondering about travel. Are visitors permitted? Can they leave on the weekends? What is the university guidance around that?
Yeah, Ben, I think that Matt would probably tell us. He's certainly told me many times that to the extent that we can prevent a significant influx of students or others coming into the community, people moving in and out of our community, the better off we're going to be in terms of managing the virus. So we are discouraging travel for students. It's one of the reasons that we've said that we're going to have classes on Labor Day, and we're going to end at the Thanksgiving break with our in-person experience because we want to avoid that problem that travel creates. We know this is an inconvenience to many, but we have to operate with good sense if we're going to be successful with this. And so that would lead us to discourage visitors from being encouraged to come to town. And this is particularly at the opening of the school year. We're going to phase this. And as our mitigation efforts succeed in keeping the virus at bay, we may be able to relax some of them. But in the beginning, we're not going to allow visitors in the residence halls. We certainly can't have overnight guests. I think that's an important thing to keep in mind. But this is a real partnership between the university and its students. And students are going to have to help by not doing some of the things they more typically would do, and travel in and out of town and having visitors come to town, especially in the early going, will be among those things that we want to discourage.
Thank you. Dr. Barron, a question we've received many times when we're thinking about people coming into town, people want to know what the football season is going to look like. Can you give us some thoughts on that?
Sure, happy to do so. So as many people know, our football players, basketball players, and later other sports are returning to campus, and they're going through a process of quarantine and testing and reduced numbers when they're training. And many people are looking at this of whether it's a signal for what might happen in the fall. And in fact, it's a signal that we care deeply about the health of our athletes. We know that we would not want to put them on the field of play if they weren't physically prepared to be there. That just promotes injuries. So that's not acceptable from our viewpoint. So as part of our planning and development, these athletes are coming back to campus. We will see over the next weeks and months much greater conversations. It's already happening across the country, much greater conversations about how we keep our communities safe. So I can tell you, for example, that I know of no school for which Penn State has interaction that is planning to fill stadiums. And in fact, at most, they're considering a very reduced number of students. So for example, electronic ticketing, no cash, different sanitation procedures, social distancing, if we are to have our fans in the arenas for which they are playing. I think you'll see more and more information about this. The Big Ten, for example, is committed to sharing a lot of different information, and the presidents are committed to making sure that we have policies and procedures that are there to make sure that we don't have massive numbers of people that reset the COVID clock, so to speak. So you can really look at the suggestions for no Labor Day, no change after, no residential education after the Thanksgiving break, as an effort not to reset the number of cases by having our students go elsewhere and then come back, or by having large number of visitors come, and therefore resetting all that effort in testing and tracing. So I think it's wise to think about that in the same mode for something like football. That again, would be an opportunity if we were to fill our stadiums with outside individuals. We would be once again resetting the situation for our communities and having the potential to create super spreader events. What we're interested in is making sure that you have that rich, wonderful Penn State experience, while at the same time keeping everybody as safe as possible. So hopefully that gives you some insight of where we are, that we have a little ways to go before we decide all of the policies, and how important it is for us to be thinking about your health as well as your enjoyment of athletes at Penn State.
Thank you. Provost Jones, one of the really wonderful things here about Penn State is that graduate and undergraduate students have the opportunity to participate in on-campus research. And how is that going to be affected as we come back?
It's true, Ben, that we are a research university, and that's why obviously we have graduate students here doing research, but it's also why many undergraduate students choose to come to an institution like Penn State so they can participate in research as well. We've actually had a pretty robust plan in place that we have been rolling out over the summer, a phase-in to research. Many of our faculty were anxious to get back into their laboratories or in some cases into their offices because of the resources that they have there to support research. Moving forward, we've obviously learned a lot from that experience, but moving forward, we anticipate that we will be able to continue to include students in those research experiences as well, following the protocols that we've established for those laboratories. And so we're excited to be able to welcome our undergraduates back. There's just rules to follow as there are elsewhere in the university.
Thank you. And as I said at the beginning of this event, we have had nearly 3,000 questions submitted for our 2 town halls today. We tried to answer as many of them as we could, but I want to again say this is just one type of communication from the university. We're going to be posting more information, more answers, and more solutions in the coming days and weeks on our Penn State news site and the psu.edu virus info site. Dr. Barron, is there any message you would like to leave people with today?
Sure. Thank you, Ben, and thank all of you for listening. I want to thank you for your continued dedication, and tireless efforts to support our community. We will continue to work with our faculty and staff and students as we evolve our plans over the summer. Your health will continue to be our highest priority as we move forward. We expect all members of our community to follow guidance that will be shared and take every precaution to prevent the spread of the virus. It's incumbent on each one of us to do our part. In fact, it's essential. The Penn State experience may look somewhat different this fall, but I'm very much looking forward to seeing our campuses busy with students, faculty, and staff once again. I can tell you I'm really eager to meet my own class this fall. To our newest students, you're going to love being here on campus and being a part of this Penn State community. And to each of our students, as you think about returning, I want to leave you with some thoughts about the importance of inclusion. Our country is going through a period of social unrest and upheaval. We're committed to making changes at Penn State that create a more just and welcoming environment for all. I expect that together we will make significant progress in fighting ignorance and intolerance. We'll embrace the power that diversity represents in fulfilling our mission to open doors of opportunity for all. That's what we're here for. I really look forward to seeing all of you soon. Thank you.
And I want to thank Dr. Eric Barron, Nick Jones, Damon Sims, Lorraine Goff, and Matt Ferrardi for answering our questions today. And we do all look forward to returning campus with you in the fall. Please keep an eye out for a follow-up story, which will include the archive video from today's 2 sessions for anyone who might have missed part of it. Please also bookmark and continue to visit psu.edu/virusinfo for the latest information and updates. There is a link here on this current website, liveevents.psu.edu. Thank you all, and again, we look forward to seeing you.